Good afternoon, everyone. Today I'm going to discuss about MRCPH prospects, post MRCPH. So after the exams, what are the career prospects for aspirants, like especially who want to study uh, further studies in abroad, or they want to do career settle down in abroad. This is mainly for those people. So before I start, I would like to introduce myself. I'm Dr. Suda. I'm one of the consultants working in Samraksha Hospital. So as I said, I have graduated my MBBS from Osmania Medical College in 2003. Then I moved to UK in 2005 in June. So I was an MBBS graduate without any postgraduate qualification. I went to UK and I started working since 2016. So in UK, I have stayed for nearly 10 years, and I have done my MRCPH UK and also DCH, which is Diploma in Child Health from UK itself. So my area is pediatrics, and I have a special interest in neonatology. And I worked in different hospitals for 10 years in UK and Ireland. And due to some personal reasons, I moved back to India in 2016. So since then, I'm working as a senior pediatric consultant, and currently I'm employed at Samraksha Hospital. So far, postgraduately, I have pediatric experience for approximately 18 years. So the reason why I've been asked to do this is to look into the career prospects. So MRCPH is considered as a postgraduate qualification in UK as well as an across all over the world. So what is your career prospects? Because it is not an easy exam to do, and you want to do this exam. Obviously, you're expecting some return. So what is your career after the MRCPH? So basically, I will talk about UK. So why we people prefer UK? Because it is a multiracial country. A lot of uh, different world people do come and stay in UK, and you see different cultural background. Like if you go to Europe in one country, you might see more of the white people. Like whereas in UK, you see all color races and population, like people from Bangladesh, people from Pakistan, India, Africa, and also from Australia. So many people come. So you don't feel homesick. And the most common reason why you feel homesick is that you don't have your relatives here, or you or food is not available. So UK, you choose it because there are different food available, and also home food, like some of the special items are easily available because there are a lot of supermarkets which are Asian supermarkets for Indian population. Like you can easily get it, and even patients wise, like in UK, patients are also from different ethnic backgrounds. So language wise, when you are communicating, it is easy to communicate with the patients and know their problems also, and it is adaptable to uh, system. Like we can adapt to the system easily because UK system is more based towards the Indian system. So it is easily adaptable. Like not many guidelines have different from Indian guidelines, and the education that you do in UK, or the degree that you obtain from UK, which is MRCPH, which is of highest standard. So there are a lot of pros or positives that you want to work in UK. If somebody is working want to work in a different country, the same thing, like but UK has much more um, friendly atmosphere to do your career further and enhance your post graduation. So, how to work in UK? There are two ways you can work in UK, but you need to show that you are qualified enough and you are safe enough. So they look into whether there is the practice that you do a safe practice. So there are two routes that you can use in to work in UK. One is a PLAB exam and one is MRCPH exam. So PLAB means it's a professional linguistic board exam. So this is an exam where you can do it straight after MBBS. So after MBBS, you are eligible to do this exam. So this doesn't have pediatrics alone. The exam itself will involve all other subjects like gynecology, medicine, general medicine, and all other subjects like anatomy and physiology and all those things. And yeah, both for PLAB as well as for MRCPH, you need English proficiency, because that is the primary language that they speak. The patients will be speaking. So the doctors, they want would be comfortable in English, that is the doctors they will choose. So IELTS is the professional speaking test that you need to pass, and you need to have a good score more than 7 or 7.5, which would be considered good enough for the organizations in UK. So PLAB has two parts in exam. One is theoretical and one is a practical exam. And after passing in this exam, so in UK the system works like it starts from training post 1. So you'll be working for about 8 to 9 years of training will be done. So for PLAB you'll be starting at the basic level, which is ST1, which is the lowest grade. So obviously if you go with PLAB, you will be working number of years will be much more longer, and your job that you are starting would be at a very basic level, which is a senior house officer level. In comparison, MRCPH is like PLAB is a basic exam. You are not getting any degree. Whereas if it is an MRCPH, you are getting a postgraduate qualification, and it is recognized in the General Medical Council, which is the medical council for UK. So MRCPH, you one, even if you don't want to work in UK, it is a degree that is recognized. Whereas a PLAB, if you have passed the exam, like you will be only eligible to work in UK. You can't work in other countries with PLAB exam. Whereas with MRCPH, you can work in different countries across the world. So that is the difference. So MRCPH is much more superior. And what is this MRCPH exam? It has three parts in it, and there are two theoretical parts, and then there is one clinical exam. Now you can take, apart from the clinical exam, theoretical exams you can take either way. Like you can do part 1 first, or you can do part 2 first, and then attempt for part 1, and then you can go on to clinical exam again. For even if you have done MRCPH, you need to show that you are competent enough in English speaking. So IELTS is mandatory here. If you have applied to General Medical Council and you have got this MRCPH degree, then you are eligible little up on the ladder. So ST3 or ST4, you are eligible for clinical training. Previously, like in the last 2 years before this, you were eligible straightly into the 4th step of the training scheme, but now they have reduced it to 3rd step of training scheme. So with only PLAB exam, you will not be eligible to step up the ladder more than ST2. Like you will be either doing ST1 or ST2, whereas for MRCPH you can climb straight away to a ladder of 3rd step. So you are bypassing the 2 steps of training that is required. So if you have done ST1 and ST2, which is like first year and second year have done, but you don't have an MRCPH degree, you can't climb up the ladder. They'll expect you to clear your post-graduation qualification to step up that ladder. Whereas for MRCPH, you can directly eligible, like for the post from the 3rd grade or the 4th grade. So this is a study or an article that has been published. So what are the specialties that are popular in UK? Especially is the first space goes for pediatrics, and subsequently after pediatrics, psychiatry is much more popular. Dermatology is also popular, neurology, and then ophthalmology is popular. Like pediatrics, if you compare in salary wise, like an average, you can start from 40,000 pounds per annum to 1 lakh pounds per annum. Whereas psychiatry, you will be having a standard like around 87,000 per annum. Dermatology is slightly more better in salary prospects, around 90,000. Neurology is also better. Ophthalmology is anywhere ranging from 60,000 pounds to 1,50,000 pounds. If you convert that in Indian rupees, like it is slightly better. Pediatrics is slightly better. Like if the more you are climbing up the ladder, you will be getting higher salary. Next goes with ophthalmology. The remaining specialties, there is not much of progress. Whereas pediatrics and ophthalmology, you start at a lower base, but there is a scope for improvement and increase in your salaries. So what is the MRCPH exam? Like why we need to do it? It is an essential component which is needed for pediatricians who are undergoing training in UK. So it is mapped according to the UK educational curriculum program. So it is approved by the General Medical Council, as they feel that this exam meets the required standards. So whoever are the candidates who are applying this exam, if they pass, they have met up to a particular standard. And this has sorry, this exam has been proven by latest research and evidence based. And this exam also changes according to the training. So if the UK training is demanding more curriculum or more subjects, so the exam is adapted as per to the UK training. So, what does the MRCPH exam comprise? So, the exam contains the foundation of practice and theory of science. These are part one exam, and then there is applied knowledge in practice, which is the theoretical exam. This is part two exam, and then the MRCPH clinical exam. So, these two parts you can attempt first, or you can only attempt the foundation of practice or theory of science separately, or you can apply for applied knowledge and then you go back to first one. So there is no way like you have to go from one to one. So this is considered a much more easier exam. The foundation of practice is more for students like who have joined the fellowship program or who are been working studying in Texila. It is like if you have like 6 months of pediatrics, you are good enough to pass this exam, or six months of pediatric experience. This also you can pass it by within 6 months to 1 year of training. So this one is like after 1 year applied knowledge, because it tests your clinical practice knowledge. So this is after 1 year of your pediatric practice, you can apply for it. By the end of your 2 years training or fellowship program that you have been doing, you are eligible to or good enough to pass this MRCPH clinical exam. So MRCPH clinical exam is more of a station-based exam. So there will be like around 10 scenario stations are there, out of which 2 stations are communication stations and one is a history taking examination, which all the students know about history taking examination. Whereas the communication and the other parts like clinical examination, looking into the systemic examinations, will take a little bit more experience. So all these three you need to pass before you are getting MRCPH degree. Okay, so why is MRCPH so popular is that it is recognized everywhere: UK, Ireland, Europe, almost Singapore, Gulf, Asia, everywhere it is recognized. And like in UK and Ireland is like it's near to UK, like it is only beside, like a neighbor of UK. Here also they have their own royal college, but they do recognize the UK postgraduate training program, and after that you can apply for their own training scheme locally. Europe is also similarly the same. Asia, like Gulf countries, MRCPH is recognized, and after post MRCPH, if you have done few years of specialist training, you can directly apply as a consultant. So they have recognized MRCPH as the equivalent to their postgraduate qualification. In UK, if you want to work, registration is mandatory. So the body that does registration is the General Medical Council, and it is considered as a postgraduate medical qualification, and language proficiency by IELTS is mandatory. So person who is going from India and he wants to work in UK, he has to provide a good standing certificate from the local medical council. So whichever is the local medical council, like state-wise Bangalore or Kerala or Telangana or Delhi, whichever is the medical council or the Indian medical council, you need to provide a good standing certificate in the last 3 months, which is eligible for last 3 months. You have to provide the good standing certificate that you don't have any criminal offenses, and then you need to provide all these things. So where do the jobs get advertised? They are advertised in the NHS board, like NHS Scotland, NHS Wales, and NHS itself they are all three separate. So this NHS covers England and Wales, and then NHS Scotland is separate. So even though they are come under part of UK, so they are separate. And again, Northern Ireland is completely separate entity. And again, you can have jobs advertised at BMJ, or there is a website called doctors.net, which is a professional online network for doctors. There also jobs are advertised. So after you have got registered with your general medical council and you have done your MRCPH, so how do you can enter into the UK system is like by specialist training scheme. So this is a specialist training scheme. candidates or students have to go through it. And what it awards is that at the end of your training you will be getting a certificate of completion, which is called CCT, and those who have completed this CCT are eligible directly for consultant post. So this CCT is awarded after you have worked in different hospital networks in UK, and once you have completed that you will be eligible to apply directly for consultant post after you get registered with the specialist register. So the UK system has level 1, level 2 and level 3. So level 1 is ST1 to 3, which tests your basic knowledge of pediatrics and child health. So they want to know that are you a safe doctor, are you able to diagnose the patient, and are you able to recognize the warning signs. So here the placements will be in the general pediatrics, they might be in neonatal ward, or they can be also community pediatric post. So to go from this third to next level, you need postgraduate qualification, which is MRCPH. It is necessary to go into level 2 training. So the advantages, like say for example you have done only PLAB, you can only go up to this level, you can't go beyond that. Whereas if you have done MRCPH, you will be going from level 1 to level 2 directly. You can skip this level 1 part and you can go into level 2 part. So level 2 is from year 4 to year 5. So here it is mainly in the district general hospitals. So you have been trained, so you will be using your existing core training. So again you will be doing more of pediatrics and neonatology. So finally in the year 6 and 8th, which is the level 3, here you will be entering into a subspecialty training. So whatever is your interest of training, that say for example you are only interested in neonate, so you pick up in only neonatal hospitals, or if you are interested in pediatric endocrinology, or if you are interested in neurology, so any specialty that you want to do, you can choose between year 6 and year 8, and you will be continuously posted in those hospitals which are accredited with the medical council. So that you have completed, then you will get the CCT. So after MRCPH, you want to know like what is my average salary, like or what is my working conditions, how is it like in especially in UK. So an average salary can be ranging from starting can be between 44,000 per annum to 81,000 per annum. So starter will start with a good salary around 44,000, which is I think around 5 8 around 40 lakhs, I think you will be starting, and then you will be increasing it. So typical working hours are around 40 to 48 hours. So there is a cap across Europe as well as in UK that you are not allowed to work more than this many hours. This is because you don't want the doctors to get tired, because when you are tired you will be making errors. So they usually made a cap of working this many hours. So in these hours you will be working some evenings only, you might be doing a shift work, or you might be working at weekends, or you might be working on a bank holiday based on the rota. So salary overview. So foundation year doctor. So when you start at the basic, like you are starting at foundation year is like year 1. So your your earnings can be from 28,000 to 32,000, and then it can go up to 32,000 to 37,000 in year 2. And when you start becoming a specialist trainee, then obviously your salary will be increasing, and then with more experience your figure will be also increasing. So a consultant pediatrician, once you have attained your training, once you have become a consultant, your salary will be basic would start from 82,000, and it can increase up to 110,000 with experience, and also if you are taking up additional responsibilities. So what about India? India also there are a lot of ample opportunities, like everywhere it is recognized. MRCPH is recognized. So MRCPH is considered as equivalent to MD Pediatrics. So you are eligible to apply for government medical colleges, also private medical colleges, because they have recognized MRCPH. Like if you go into our Indian Medical Council, MRCPH is recognized as a postgraduate qualification. So you need private sector, they have started recognizing most of the private sectors across all the metropolitan cities. Those who have worked from MRCPH, they have been recognized and they are allowed to work as a senior consultant also. In a government college, because it is recognized as an MD Pediatrics, you can start as a level of assistant professor. So it is recognized by medical council. It is starting as an MD Pediatrics, and it is equivalent to assistant professor job in a medical college. So from there, you will be, based on your experience, you will be, can go up to an associate professor, or you can become a professor of pediatrics. So, but it is recognized as equivalent to MD Pediatrics. So so post MRCPH, you work as a consultant. After MRCPH, you will be working as a consultant. So your average salary will start post MRCPH at 2 lakhs per month. And there are also research opportunities that are available, that you can do it like in pharma companies, or in teaching hospitals where there is research opportunities also. You can start working with MRCPH. Okay, why MRCPH is that much qualified across the world is that it is of highest standard. Uh, People do know that it is not a simple exam. Like, the pass scoring system for MRCPH is 120 marks total in all the clinical stations. It is 120 marks, and for that you have to get 100 marks to pass the exam. So anything more than 80% only, you will be passing the exam. So to get 100 marks, if there are 10 stations in the clinical exam, you need to get each station 10. Like 120 is like, you are talking about 12 marks per station. So in 12 marks per station, every station you should get 10 marks. So the students who are able to pass MRCPH is of higher caliber. And also the theory parts, part 1 and part 2, that I have discussed earlier, that also you will be you will need to get around more than 70th standard sentence. So whoever has passed more than 70 to 80% only, they will be passing this exam. So that is the high standard. Like, it is not a simple exam. There is no recommendation. The examiners that come in the MRCPH exam are totally new. They will be not biased. There is even the stations also, they have like a particular set of marking how you can do it. So with that only, you get more than 100 marks, you are passing. Okay. And the standard that is being followed helps you to become a better clinician, and it also helps in a safer practice, and your communication skills with the patients is also better. So MRCPH is a very good exam that you can take up. And beyond that, like, there are ample opportunities across, like in Dubai, and also in Australia and Canadian board, or a US also, MRCPH is recognized. But once you go in, like if you are going for a temporary part, like, you want to do only like a 1 or 2 years of fellowship there, and then you want to come back to the country, you don't need to pass your exams, local exams that are there in their country. But if you are want to settle down, then with MRCPH, then you need to also do their local passing exams, like how UK has PLAB exam. You need to do some kind of a fellowship exam there. But if you want to only go and then do your fellowship or postgraduate training in other countries, you can do it with MRCPH qualification. So it is recognized all over the world, and I highly recommend that MRCPH is being done, because there are wonderful opportunities outside. Thank you.